A urinary tract infection, or UTI, is a common infection that can affect any part of the urinary system, including the bladder, ureters, kidneys, and urethra. UTIs are extremely prevalent, affecting about 150 million people globally each year. Roughly 50% of women will experience at least one UTI in their lifetime. UTIs occur when bacteria, most often E. coli from the digestive tract, enters and infects the urinary tract. The infection often begins in the urethra and moves upwards into the bladder, causing an inflammation reaction with bothersome symptoms. If the infection spreads to the kidneys, it can have more dangerous consequences. The most common UTI symptom by far is a persistent urge to urinate, or a burning sensation when urinating. However, there are a number of other important signs and symptoms that can indicate a UTI as well. Being aware of all the potential UTI symptoms can help you get prompt treatment and find relief faster. In this video, we'll cover the science behind UTIs. What exactly is happening in the body to cause the common symptoms like painful urination? Then we'll go over the wide range of potential UTI signs to watch out for. The specific symptoms can provide clues as to how severe the infection is and which part of the urinary tract is affected. Finally, we'll discuss different treatment options, from at-home care to prescription antibiotics. Let's start by going over the mechanics of how urination works normally, and then see how a UTI disrupts this delicate system, leading to irritation, inflammation, and infection symptoms. The urinary system's main role is to filter waste and excess water from the blood to be excreted from the body. The kidneys filter the blood continuously and produce urine, which travels down slender tubes called ureters into the bladder. Sensory nerves in the bladder wall signal when it's full, triggering the urge to urinate. To urinate, the brain signals the muscular bladder wall to contract, while simultaneously relaxing the urethral sphincter to allow urine to exit the body. For normal pain-free urination, the urinary flow should be completely unobstructed. A UTI occurs when pathogenic bacteria adhere to and multiply along the urinary tract lining. The infection triggers the immune system to release white blood cells and inflammatory chemicals to fight the invading bacteria. This leads to swelling, redness, and irritation of the bladder and urethral tissues. The inflammation narrows the internal drainage passageways, making urination difficult and uncomfortable. The bacteria and inflammation also irritate the bladder nerves, causing persistent urges to void. So the infection essentially sabotages the entire urinary drainage system. Now let's examine the most prominent UTI symptoms in more detail to understand why they occur. 1. Burning sensation when urinating. The most common UTI symptom is a burning feeling when urinating. Up to 95% of people with a UTI experience dysuria or painful urination. The bacteria and inflammation within the urethra and bladder lining directly irritate the mucous membranes, causing a painful burning sensation. 2. Urgency and frequency. Over 80% of UTI patients deal with a frequent urge to urinate, even though little comes out when they try to go. Recurrent urges to urinate at least every 2 hours qualifies as UTI frequency. This symptom occurs because the swelling and inflammation from the infection irritates sensory nerves in the bladder lining. The nerves misinterpret the irritation as a sign that the bladder is completely full, triggering urges to urinate. Simultaneously, the inflammation restricts urine flow through the urethra. The combination of excessive urges to go with difficulty passing urine equals UTI urgency and frequency. Essentially, the infected urinary tract demands emptying constantly with little reward. 3. Pain and tenderness in lower abdomen or back. Up to 75% of individuals with a UTI experience abdominal discomfort. Lower abdominal pain results from a distended, inflamed bladder. The stretching sensation becomes especially noticeable when the bladder fills. Some people also develop kidney infection symptoms like upper back and side pain. This indicates the bacteria has spread upward from the bladder to infect one or both kidneys. The renal structures swell with immune activity, causing localized discomfort and tenderness. 4. Cloudy, bloody, or foul-smelling urine. Cloudy urine full of sediment indicates substantial inflammation and discharge from the lining of the urinary tract. Normally, urine should be clear and pale yellow, so cloudiness suggests infection. About 25% of UTI patients see blood in their urine, giving it a pink or red tinge. This symptom often results from fragile, inflamed capillaries rupturing easily. Though rare, some people notice their urine has an unusually foul, pungent odor. This suggests a robust immune response, with high white blood cell debris and bacteria being flushed out. Number 5. Urethral discomfort. An inflamed, irritated urethra can cause intense itching, burning, or swelling around the urinary opening. Discomfort may also radiate towards the genitals. Women often feel like they constantly have to urinate, even right after going. This urethral irritation links to the body's vigorous efforts to flush out bacteria. The swelling constricts urine flow while moving debris and immune cells rub directly against the lining. Women's shorter urethras also allow infections to spread more rapidly up into the bladder. Number 6. Pelvic pressure and discomfort. Women with UTIs may experience pelvic heaviness and cramping reminiscent of menstrual cramps. The expanding infection and swelling places outward pressure on the bladder, urethra, and surrounding pelvic structures. Moving, walking, sexual activity, or a full bladder tends to intensify the discomfort. 7. Malaise, fatigue, and weakness. Roughly half of individuals with a UTI suffer from overall ill feelings, exhaustion, and lack of energy. This systemic response results from the wide-reaching effects of inflammation and immune activity permeating the body. Pro-inflammatory signaling proteins enter the bloodstream, carrying messages of infection to the rest of the body. The brain, muscles, and metabolism react as if battling a major illness, resulting in deep tiredness and debility. Number 8. Fever and chills. Low-grade fevers, chills, and sweats affect around 30% of people with UTIs. Like the fatigue, this is a systemic sign that the immune system has gone into overdrive in response to a spreading bladder infection. Bacteria have escaped the urinary tract into surrounding pelvic tissues and even the bloodstream in some cases. The body employs fever strategically to make conditions less hospitable for the multiplying bacteria. Shivering chills are the body's way of revving up heat production. As we've discussed here, urinary tract infections can cause a wide assortment of bothersome symptoms. The most common features, like burning with urination, pelvic pain, and constant urges to void, relate directly to the inflammatory irritation in the bladder and urethra. Yet many UTIs also cause fatigue, shivering, and fever, indicating a systemic immune response. What are some key points to remember? First, urinary symptoms in combination very likely indicate an active UTI. Isolated dysuria or abdominal discomfort could result from other causes, but simultaneous urinary urgency, frequency, and burning make UTI almost certain. Second, additional systemic symptoms like fever, chills, and malaise increase the likelihood of kidney involvement or urosepsis. This warrants prompt medical attention rather than just treating at home. Finally, certain populations face higher UTI risk and complication rates if an infection goes untreated. Groups like infants, men over 50, pregnant women, diabetics, and the immunocompromised warrant extra vigilance for any potential UTI symptoms. Catching the infection early in these groups minimizes chances of kidney damage. Treating a UTI involves eliminating the infection and providing symptomatic relief. Doctors often prescribe antibiotics, which come in oral pill and intravenous forms. Some patients also benefit from non-steroidal anti-inflammatory pain relievers and urinary analgesics like phenazopyridine to soothe tissues while antibiotics work. At home, care focuses on flushing bacteria from the urinary tract, drinking extra fluids, urinating frequently, taking cranberry supplements, and avoiding irritating foods are key parts of self-care. Applying hot packs can ease muscle spasms and discomfort as well. For recurrent UTI sufferers, preventative antibiotic protocols are an option to break the cycle of repeat infections before they start. Paying attention to potential UTI symptom triggers and modifying behaviors can also help prevent regular UTIs for some people prone to them. Thanks so much for watching. Please like and subscribe and leave any questions or comments below. Let's have a discussion about ways we can prevent recurring infections and when it's wise to seek professional treatment for a bothersome UTI. We covered a lot of ground discussing various urinary tract infection symptoms and why they happen. Let's do a quick recap. We started with an overview of how UTIs happen when bacteria invade and multiply within the urinary tract, sparking irritation, inflammation, and immune activity. This leads to a number of troublesome symptoms. Then we examined some of the most prominent UTI features like burning pain on urination, pelvic pressure, constant urges to void, and systemic illness responses. We explored the physiological mechanisms behind them. Understanding why these UTI symptoms occur provides helpful clues in determining the type of infection and best course of care. Unique manifestations like kidney pain, foul urine odor, or fever indicate escalating seriousness. Finally, we outlined both at-home UTI remedies as well as medical treatment options. Lifestyle measures help ease discomfort and prevent recurrence, while antibiotics, pain medication, and preventative protocols help cure infections. I hope you found this overview of UTI causes and symptoms empowering and helpful. Please let me know if you have any other topics related to urinary health you'd like covered in a future video. Providing people with knowledge on how their bodies work is one of my great passions. Before we end, let me again emphasize, if you suspect a UTI based on symptoms like frequent urges to pee, pelvic pressure, or burning with urination, do not delay in seeing a doctor. Catching and treating early leads to the best outcomes. Cranberry juice and hydration alone won't cut it. Thanks again so much for watching. Please give this video a thumbs up if you learned something valuable today, and subscribe for more content on urological health coming your way soon. I want to help you keep your urinary system working smoothly so you can live life to the fullest. Thanks for watching, and we'll see you in the next video.